we're here. Do you want premium ad-free content? Duh. Content that's not censored by big tech, of course. Well, with SD Insider, you can get behind the scenes and a whole lot more. Link in the description. By the way, before we get started, there are 2 products which I will never carry in my kits again. One of those products being anything that is super glue-like for wounds. The next thing may surprise you, Dr. Bronner's liquid soap. Once that stuff gets out, it is evil, and my stuff still smells like lavender to this day. So the request that I often get is, JJ, what do you carry in your kit? Considering your background, I'd like to see what is it that you carry when you're in the field. Now, before we get started, disclaimer, disclaimer, disclaimer. Understand that what I carry in my kits, it is inversely proportionate to my skill set, and so what I carry is probably going to be a little bit different than what you carry. So before we even start, you should always operate within your scope of practice. All first responders understand, because they have been through a lot of training and they have to recertify, and it's just a constant cycle of training and experience. But we all understand that we all have and had a duty to act within our scope of practice. And rule number 1 was do no harm. And I know you watch a lot of videos on YouTube, and you know, this is something that you want to be the force multiplier. You want to be the person that comes in, the hero that saves the day, and you want to do as much good as you possibly can. And because of that, a lot of people do the monkey see, monkey do thing. They see like fancy kits and they say, okay, this guy is running that kit and I need to have that kit. The problem is, if you don't know how to use the kit, then you can actually become part of the problem rather than part of the solution. And I also think that there's a lot of misconceptions here on YouTube because, I mean, you just don't know what you don't know. And I hear a lot of people, you know, they present this argument, well, if I carry all the fancy cool toys and stuff, even if I don't know how to use it, then somebody around me probably will. And I would like to say that that is possible. However, I can tell you as a first responder myself that I am extremely picky about what goes in my kit. And because I have a duty to act within my scope of practice, that determines what I carry. Now, I'm not saying that I'm not grateful if somebody has a bunch of stuff around, but there are pros and cons to this. For example, a lot of people, they purchase prefab or pre-made kits. This can be good and this can be bad. Let's say you purchased a kit back in 2018. Well, time has passed and maybe a lot of the protocol has changed. Stuff that you're just not in the biz, so you're just not aware of. The medical field is constantly changing and there are constantly updates, and unless you're in the business, then you probably aren't aware of those changes. And so a kit that you purchased, you know, a couple years back, it may be almost obsolete today. And believe me, I understand it, because when I was in, I've been retired for 3 years now, but when I was in, a company would come out with a new kit. Maybe it was from Blue Force Gear. They came out with a new medium level whatever kit, you know, with the fancy Helios system or something like that, and I just had to have it. Well, it may shock some of you to hear this, but as soon as those kits would come to me in the mail, I would literally start tearing down that kit, like ripping into it, because I wanted to see the components of that kit. And that may horrify some people because they say, hey, Jay, the components of the kit are in the, you know, vacuum seal packaging for a reason. Well, first responders will tell you, number 1, we want to know exactly what we have. And number 2, being tactically efficient is really important. And number 3, the components of our kits, they typically go out the door really fast. In the field, we don't have the luxury of, you know, keeping hold of all of those components for long periods of time. We're there to use them. And that brings up kind of like the first problem with these pre-made kits. Let's say you purchase a prefab kit, and usually it's proprietary to the company that you purchased it from. Maybe it's a color coding thing, or they designed the clamshell or some other type of breakaway system, and the products that are in that kit are, well, proprietary to that kit. They go in that kit, and you use one component out of the kit, and now you have to replace it, and maybe that company went out of business, or maybe it changed protocol, or it changed the way that you carry it, etc., and it presents a problem. The next problem that I typically see with kits like that is people, they haven't gone through the kit, and when the emergency happens, all of a sudden it's like the drag tree goes off and the light turns green, and it's a little bit chaotic, and they're throwing stuff out of the kit onto the ground, and they don't take the time to read the packaging where it says, you know, peel here, and now they're ripping with their teeth, or they take their knife and they rip the package open, and guess what? They cut through the very thing that they were trying to use. Another thing is the amount of time that goes into all of this. If you haven't ripped open those packages properly from the get-go, it usually takes a lot of time, especially when it's time critical. Like if somebody has a bleed going on and it's time critical, you don't have time to become familiar with your kit on the fly. You need to be familiar with that kit before the problem even happens. I think the biggest one that I see with kits like that is the surgical gloves, for sure. First responders, we don't hold on to our EMT gloves and all that for months and months at a time. We are constantly replacing the PPE in our kits. What I typically see is the surgical gloves, they're in some kind of vacuum sealed package, and they've been, you know, scrunched together as tight as they can be to try to save space in the kit, you know, so you have the lowest profile kit you know, that you can have. And then also things like that are affected by heat. So if, you know, it's really hot wherever you are, and those gloves have been baking inside of that kit in the trunk of your car or in your backpack or whatever, and you try to, you know, take the package open, you rip the glove, just literally trying to get the glove out of the package. And a word about gloves while we're here. This is going to really upset some people, but I'm going to go ahead and say it anyway. All first responders will tell you, yes, you need PPE, right? You need to up your chances of it protects the patient, it protects you, it's just smart, right? But most people don't give enough credit to their skin. Short of you having a cut or a scrape or some kind of open wound, your skin actually does a pretty good job of protecting you. All first responders at some time or another have had the nasty, sticky, gooey stuff that's not yours on their skin, and we've all had to wash ourselves off. I guess what I'm getting at is if somebody does have a critical bleed and you have ruined your gloves in the process and you don't have any nicks or scrapes, you might be okay. But ultimately, in the end, you have to make the decision, and I would always tell you to have proper PPE. Now, the way that people like me deal with it, this right here is just a little glove pouch that goes on my belt. You can see right here is where it slides into the belt, and it's a rip away, a Velcro, and inside of it, that's where I keep my gloves. And I have two sets, and I don't try to compact it so tight that I can't use the gloves. I simply blow into the glove and I go ahead and I put it on my hand. Now, another thing too, I have gloves that fit me perfectly because I have double XL hands. If you have those, you know, gloves that say one size fits all, they may or may not fit you, and they're probably not very durable either. I make sure that I change my gloves out in my little pouch here about once every, well, I change them out pretty regular, but let's say that I didn't use my gloves that often, I would at least change them once a season, about every 3 months or so. Now, what I do instead of ordering from like North American Rescue, for example, I just go to Harbor Freight and I buy nitrile gloves, and I keep a box inside of my Jeep, and every so often I just change the gloves out just to make sure that they're not going to break on me and that they're readily available, and I'm not going to have to go through some kind of packaging to put them on. That's one of the biggest problems that I see in the field. It's real easy to just scrunch a couple sets of gloves into a pouch like this, wear them on your belt, and they're with you at all times, and you just don't have to worry about it. All right, now that we've gotten some PPE out of the way, we can talk a little bit about, okay, well, what do you carry on your person? So some of the stuff that I carry with me, I always have some kind of baby wipe in my pocket. These things, they have alcohol in them. Yes, you can use them for treating wounds. I also have stuff for controlling bleeding. Like I always have a couple bandanas in my pocket. They're just really easy to access if I need them, instead of having to get into a medical kit for my sterile 4x4s. Now, am I saying don't use sterile stuff? No, I'm not. I'm talking about emergencies. You need to understand a little bit about my background, okay? I would have to search for the patient. I would have to stabilize the patient, package the patient, and get them to a higher level of medical care. Understand that once that person gets to the hospital, they're going to take care of all the fancy stuff, and they're probably going to pump them full of antibiotics, fluids, and all the other stuff that they need once they get to the hospital. Now, in an SHTF scenario, you may not have that luxury, and I get it. But statistically speaking, most emergencies happen under 72 hours. So I'm going to say like 95% of the time, go ahead and take care of the patient, but understand they're also going to need another level of care afterwards. Now, if we're talking about like apocalyptic, end of the world type stuff, that is a whole nother ball game, and that's not what this video is about. This is about taking care of what you can with your level of care. Something else that I carry in my pockets is what I would consider an IFAK. Now, there's a lot of misconception about what IFAKs are, and if you're not trained, you probably have heard about it. It's an individual first aid kit. Now, I think the misconception is that people think, okay, basically I have the medicine cabinet on steroids in the field so I can take care of all kind of like, you know, simple ailments and complaints, etc. Like that's not what an IFAK's all about. In my particular case, as the Alpha Squad leader for my team, I would have the responsibility of being able to take care of not only myself, but my team, and then whatever patient or patients that we came across. The majority of my kit was all related to first aid, but I also had my rope gear and I had my survival gear, and that pack weighed 72 pounds as a SAR-1. That's a lot of gear to carry, and I am in no way suggesting that you should have a pack that weighs that much. It's different when you're in a professional setting versus, you know, hey, you're just going camping, maybe you're trying to put together your get home bag or the first aid kit for your car or something like that. The whole reason that I even bring this up is because I was responsible for those people. And if you're watching this video, maybe you're the head of your household and you feel this need to take care of your family members or the people in your group, etc. Now, the way it worked for us in the field as professionals, I would have a jump kit that had all the fancy tools and toys and stuff in it, and then each member of the team would have an IFAK. Now, an IFAK may not be exactly what you think it is. It's typically there to control, you know, bleeding, like extremity bleeds, to treat for shock, to create and or maintain airways, and there's a lot of things inside of an IFAK that you have to have a certain level of training for. For example, if you don't know the difference between an OPA or an NPA, and you don't understand what 28 French means or 20 French means, an IFAK is probably not the way for you to go. Typically in an IFAK today, currently, they always have trauma shears, they always have some kind of emergency space blanket in them. They'll have compression and pressure gauze and bandages. They'll have lights. They'll have, today I think NPAs is probably more, and that's a nasopharyngeal device, in case, you know, there are those of you that don't know what that is. And a lot of people, they don't understand how all of this stuff works because they don't have the training. And so I wouldn't recommend that to you. Like, of course you see us run IFAKs in the field, but you know, if you don't know how to measure to make sure that you are maintaining someone's airway properly, I really wouldn't recommend it. And there are what we call the X factor scenarios where maybe there's something like major head trauma and you can actually kill somebody by doing it incorrectly. And I'm not saying that that happens all the time. I'm just saying that the chance exists. And so that's why there's medical protocol in place. And so I wouldn't suggest that you mess with that stuff unless you know what you're doing. What I am suggesting is that you take the principles of what I'm talking about and you apply it to your level of training. For example, as the head of your house, yeah, maybe you are the one that carries the jump bag, if you will, that has like the major stuff in it that, you know, you can take care of. And then your family members, they have their own little individual first aid kits that has stuff that they can use. Say your kid has ADD. I know that you don't want your kid carrying around methylenphenidate or amphetamine salts or whatever it is that they take. Okay, I'm not suggesting that you just give drugs to kids. I'm also not suggesting that you let your kid have a scalpel or a suture kit or something like that. They don't need that kind of stuff. Something that will free up ounces in your pack is if you allow them to carry things like Band-Aids or some triple antibiotic ointment or you know, just small first aid supplies that your kid, that you have the responsibility to train them on, but they can carry some of that stuff. And then you can carry the other stuff in your kit that might be potentially dangerous to them. So it's really the principle here that I'm trying to get across to you as to, you know, if you want to act like a professional team in the field, you can still take the principles from that and you can apply them to your situation. Most people are going to look at this bag and they're going to say, I want to know what's in that bag. Okay, I'm not going to show you what's in this bag because this has all the cool stuff in it that you're probably not trained on. And so we're just going to go ahead and take it out of the equation because there's no need for us to go over that stuff if you don't know how to use it. And I will say there is no way that you can watch YouTube videos and you can gain the experience that you need in order to use that stuff. Anybody who has been through the level of training, and if you're a professional and you're watching this video, you can help me out in the comment section. Believe me, when I was in school, I probably theoretically killed, I don't know, 100 or more patients. All right, and then when I got into the field itself, after I passed the test where I was going to get the small envelope or the large envelope, that's when my real training began, when I got on my first ambulance. And then after I passed all those practicals and, you know, I got certified and licensed and all that stuff, and I go out in the field and my first call is a diabetic coma, I promise you there's nothing that can prepare you for that kind of scenario. There's really no substitute for training. Just because you understand something theoretically does not mean that you're going to react properly when the scenario actually happens. So I would encourage you to get out there and train, train, train. Today, what I'm going to focus on is something that I think that you could put into your kit and it would make you a force multiplier and it'll just help out the people that you care about. Now, this part of the kit right here, this is what typically goes in the backpack, all right? It's not what I typically have on me. And this kit right here, what it does is it's modular, it's MOLLE, right? It goes onto this kit, which is part of my jump kit, and I can separate it and I can take it with me if I need to. Now, most of the time when I'm at events or I'm teaching or whatever and something traumatic happens, I can send people back to my vehicle and I can tell them to grab my jump bag, and I typically will have most of the stuff that I need on me right then and there to take care of the problem. And that's why the majority of what I carry on my person typically, well, it's related around stopping the bleed. Now, I want to have a word or two about stopping the bleed because a lot of people carry a product called Quick Clot. Now, that's not to be confused with the company Quick Clot because they actually produce a lot of products, not just the granules that you pour into an open wound to stop the bleed. Myself, personally, just based on my experience, one thing I can tell you as a first responder is if you choose to put those granules into an open wound, understand that whatever goes in has to come back out, and in some cases it can be very painful. Now, I'm not saying that there's not a place, you know, to have Quick Clot on you. Some people that have that are anemic, for example, they've been drinking a ton. Maybe they're on blood thinners. Okay, I'm just letting you know that in my world, that's typically frowned upon by the hospital. There are lots of products out there where you can, you know, stop the bleed, even made by the company Quick Clot, that you can use, pressure bandages, compression bandages, etc., that will help you out in a situation like that. And so I would typically steer you away from that. I'm not telling you what to do. I'm just kind of talking through experience here. Now, most people want to know what I carry in this kit, and it's pretty simple. I have a tourniquet in there. And when it comes to tourniquets, I really prefer cat tourniquets. It's what I was trained on. I just find I've been trained on a lot of different types of TQs, but in the end, I just particularly like cat tourniquets. And I'm not going to say that other ones don't work. What I'm saying is that when you get into a high stress scenario and there's blood everywhere and you've got stuff all over you and there's stress and all that, sometimes the other tourniquets don't work as effectively as a cat tourniquet will. Carry what you will, but just be aware that I've never had a failure with a real cat tourniquet. Now, there's a lot of fakes that are on Amazon. If you're going to buy a tourniquet, I would suggest that you get an official cat tourniquet, and you're gonna pay somewhere in the neighborhood of close to 30 bucks when you buy one. But I promise you, if you ever have to use one in real life, you will thank God that you bought a good one. Also, inside of this kit, I have things like acetaminophen or Tylenol, ibuprofen, like Advil, diphenhydramine or Benadryl, and I also have baby aspirin in there as well. I also carry things like electrolytes inside of this kit. I typically have something to help with people's blood sugar with it. I also carry a space blanket inside of there. That kit isn't going to solve all of the world's problems, but I do have a lot of stuff on me that I can take care of stopping the bleed immediately. I also have stuff in here that I can help treat for shock later. And I also have some stuff to take care of just some common ailments and complaints, etc. Now, this may surprise a lot of you, but I do carry Gorilla Tape. I don't typically carry like Band-Aids with me, and that may shock some people. I'm not saying don't carry Band-Aids. What I'm saying is that in search and rescue, a lot of times we would just get down and dirty with it. Like, we always carried 4x4s, and I always had trauma shears, so I could always just cut it up and I could make Band-Aids if I needed to. The majority of what I would focus on would be major trauma type stuff, and I'm not really like worried about secondary injuries like, oh my God, a thorn cut me. What I will say about Band-Aids, a lot of times if you're dealing with kids especially, they can be a comforting item. So if you do have kids, it is a good idea to have Band-Aids, and yeah, go crazy with the designs or whatever that come on them, because kids love that stuff. All I'm saying is that I can pretty much make any kind of bandage that I need to, as long as I have Gorilla Tape and then something that I can use to stop the bleed. Past that, like in my pack itself, I don't just have this kit. I have other stuff that I use for multiple purposes. Like, for example, in my hygiene kit, I have this mirror. Now, before someone asks, this is not a Wazoo mirror, okay? I just took some stickers and I put them on a cosmetic mirror that I keep in my kit. And what's important about this piece of kit is it has two different mirrors in it. One that's just a regular straight 0 power mirror, and then the other one which is a 10 power. And this really helps out if you get something in your eye or you have something on your face. It really helps to have the magnification. Another thing that I keep in my kit are shamogs. I typically have 2 of them in my kit. One that is orange or hunter orange, safety orange, that I can use for signaling. And also, one thing that's really nice about these shamogs is you'll notice these little tassels that come on them. They give you the ability to rip off whatever you need to, so that you can create any size bandage that you need to. I honestly don't know how many slings I have made with these things over the years, because a radius ulna is a pretty common thing that happens out in the field. I use it for other things as well, like, you know, covering my face. You know, if there's bugs around me, I use it for filtering water. I use it for carrying stuff. I'm making like fanny packs, improvised fanny packs. There's just really tons and tons of uses for having a shamog inside of your kit, and I absolutely consider it part of my first aid kit. Now, when I was in the field, like when I would go onto disaster scenes, I would always carry a twin cotton sheet, just a plain twin cotton sheet. Because one of the things about being in a disaster scene is supplies just go out the door so fast. You can imagine how many different bandages and slings and splints and all the other stuff that you can make out of a twin cotton sheet. Now, I'm not suggesting that you carry that in your kit. I'm just saying that's something that I did when I was in the field. So there's your free tip or trick or hack or whatever you want to call it. One thing I do like to have, though, is a lot of cotton material around me, though, just so that I can use it for whatever needs come up in the field. Another thing that I consider part of my everyday carry that's on my person is a good flashlight. If I need to check pupil response, it's nice to have one of these on you. Also, if it's dark, I mean, being able to see the wound, etc. I mean, it just makes sense to have a light on you. Another thing that I consider part of my kit everyday carry is having a Sharpie. If I need to write on the patient, either on their forehead or on their arm, I always have a Sharpie because I have used this 1,000 times. It's just a good thing to have in your kit. Another thing that I carry in my pockets is just a Write in the Rain book, so that I can write down whatever I need to for my handoff report, so that when medics get on scene, I can hand them everything they need to know right then and there. I also have the magnifier. This one is a 10 power. I've used this, I don't know how many times in an emergency to look at people's wounds. And then of course, I have my knife. Now, a knife is not a substitute for just a good old pair of trauma shears, but I have a lot of experience with a knife. I've had to cut off I don't know how many people's clothes in emergencies over the years. And yes, when I was a professional, I used trauma shears, but I have in emergencies used my knife. Something else that I should mention is I typically have some kind of pad with me, and I also carry soap with me. It is really nice to be able to disinfect yourself after handling an emergency. I also have myself a military grade space blanket. I'm not saying that you should carry one of those or like a grabber blanket or whatever, but it's really nice to have something that you can reuse over and over again, instead of the cheap safety or space blankets that people buy. If you have a really cheap one that comes in a prefab kit, I would totally try to steer you away from that. They tend to stick together and they rip and they tear, and they're pretty much useless, but do what you're gonna do. Now let's jump into this kit, because I think this is what everybody came for. Let's just see what I have inside of here. So first of all, I'm gonna take all this stuff and I'm just gonna put it off to the side. I think the whole point in me showing you that is, you need to be tactically efficient, and you don't have to have every single thing for your first aid kit in one pouch. You can have it spread out on your person or in your bag, etc., and it just force multiplies and makes you that much more effective. Okay, so let's just open it up and let's see what we have inside of here. For one, this thing unzips very easily and it gives you full access to the kit, so you don't have to worry about fumbling around trying to find stuff or whatever. It's just really easy to get to everything. So right on top, I have an official CAT tourniquet. I hope that you never have to use one, but there may come a day when you actually do. And if you do have to use one, please get a good one. The next thing that's on top is this pouch right here. And this is what has stuff for bleeding in it. These are my 4x4s. I also have occlusive dressings in there. I have moleskin in there, things that are flat. Let's see, what else do I have in here? Yeah, so I have wet dressings, I have dry dressings, etc. This one's nice and flat, and it just fits in the back of this really easily, and I can just pull it up straight away, and there's my 4x4s if I need them, which is probably the most common thing that you're gonna need in a kit like that. Next, on top of that, I have, my sterile gauze that I can use for a variety of things. And then I like to use the self-adhesive wraps. I can't stand using those little hook things like that. That drives me insane. I hate those things. So I use cling wrap when it comes to that part of my kit. But I don't think there's any substitute for just some good old-fashioned Gorilla Tape. You can do a lot of stuff with this thing. Plus, I mean, it has lots of other uses besides, medical. I mean, it just makes sense to carry Gorilla Tape. That's why I carry it. Right here at the very back of the kit, next to where I keep the 4x4s, are my trauma shears. Now, a word about trauma shears. Not all trauma shears are made equal. You don't really need the best of the best when it comes to trauma shears, especially if you're not a professional. Over the course of my career, I found trauma shears that worked for me, and you can use them more than once. And so I would just recommend that you find a good middle of the road pair of trauma shears. But yes, they are very handy to have, and I wouldn't think of going out with a first aid kit without a pair. The next thing is stuff to control trauma. This one right here is made by Don't Die in the Woods. It's an emergency blanket, and this one right here is actually a really good blanket. This is not the cheap one that comes in your prefab kits. This one will spread out and it doesn't rip easily. It's a really nice footprint. You can use it as an improvised shelter, etc. So that's what's next in the kit. Next thing, I have another Sharpie. And like I said, if you need to, write on a person, you've got another one in case your primary fails, redundancy. People's vitals, that's pretty important. And if you have the ability to take those vitals, then you need to write them down for the medics. You can also write down the time that the emergency took place, and you can do your follow-ups, 10 minutes, 15 minutes, whatever the case may be. You can keep a log on somebody. And so I like Sharpies just because they work really well. And also this one is a fine point, so that if I need to write in my Ride in the Rain, or I'm writing on another piece of paper or something like that, it just makes the writing nice and neat. So Sharpies next. After that, a word about irrigating wounds. This one right here is an antiseptic cleanser, and when I get done with a bottle, what I do is I just fill this bottle up with isopropyl alcohol. Now, one thing that's nice about this bottle is if I need to irrigate a wound, I can do that. I can apply as much pressure as I want to with it. And also it's spill proof and it's plastic. If I drop it, I've never had this bottle right here by Band-Aid break inside of my bag. And like I said, it's refillable. I don't recommend that you just carry anything in your bag. You don't want stuff busting or breaking inside of your bag because it will ruin all of your supplies. So I would highly recommend that whatever you do carry, most people carry like a little bitty bottle of it, and that's not enough. Okay, what I typically tell people in the field is if you have clean water, right? You have a water bottle, just poke a hole in the top of that bottle and use that like a syringe, like you would use to irrigate wounds. I do have various size syringes inside of my actual jump kit, but just for something really fast, quick, down and dirty in the field, I'll use a water bottle first, and then I'll finish up with this afterwards. But I think the biggest thing that I'm trying to communicate to you is you need a lot, not just a little bitty bit. This right here is 6 fluid ounces, and I think this is about the smallest bottle that I would carry. All right, the next thing is a good set of tweezers, not a cheap set of tweezers. I would buy yourself a good set of tweezers, one that has a point and a flat on there. I just find that these things are really handy when you're in the field, and I wouldn't think of going out without having a pair of tweezers. Next is a bag full of stuff. Let's talk about what's in this bag first. When I was in the field, we used to carry glucose with us for people's blood sugar problems. But nowadays, instead of replacing that, and I guess I have my own problems with that as an EMT, it's better to hook somebody up and shoot them full of the stuff that they actually need in the field. But you're probably not certified to do that sort of thing, and so just having some kind of hard candy, a lot of times too, even if it's not a blood sugar issue, a lot of times it's just soothing to people if you give them some kind of hard candy, just something for them to suck on for a little while, and it'll usually calm them down. So like for kids, for example, or even some adults, having just some lifesavers can be a lifesaver. Now, I had mentioned the types of medicines that I carry with me. This one right here, this is Benadryl that I have pre-crushed up. In case someone is going into anaphylactic shock, I can at least try to stop the big wave that is coming, so that we can move forward with it. And it's kind of a pain in the butt to have to crush this stuff up in the field, and so I already have it in bags ready to go, and they are measured out. So I have 25 milligrams and I have 50 milligrams, etc. So these are not the tablets, these are the pre-crushed Benadryls that I carry. Another option that you could have is liquid, but I typically try to stay away from liquids as much as I can. I've just found that this has always worked for me in the past. So I always have Benadryl, I always have ibuprofen, I always have Tylenol. Oh, here's another one, Dramamine. I tend to get sick on boats after a while. I can last for a long time, but eventually it's going to get me. Dramamine is really good for motion sickness. And then I also have baby aspirin in here. Oh, and I can see that I need to replace it, or maybe it's in there. I'm not gonna look in there. I always have redundancy built into the kit though. So I have the baby aspirin in this kit, and then I also carry it in this one. So I can see that that's something that I need to write down that I need to replace in my kit. So I'm gonna go ahead and go to my Ride in the Rain, and I'm gonna go ahead and write down that I need to replace baby aspirin into the kit that goes into my bag. There we go. Now I have a record of it and I know what to go get. I also carry just some triple antibiotic ointment. I don't try to get like fancy with it and have the pain relief stuff and all that. Just something to help protect that wound and get the healing process started. So I have some triple antibiotic ointment. Here's a big one, Lotrimin, and I carry the good stuff. And there's a reason for that. I don't know if you've ever had trench foot or you've had jock itch or something like that. Oh my God, that is a bad day. So I carry Lotrimin in my kit for such a thing. Another thing that I carry is prescription strength hydrocortisone. And you'll notice that my stuff is used. And this is one reason why I don't like the prefab kits, is because I use this stuff constantly and all the time. I think it's a good idea to have hydrocortisone. If you don't have prescription strength, that's fine. You can buy, you know, stuff off of the shelf, but I like to have prescription strength hydrocortisone in my kit. After that, another thing that I carry in here is just an antacid. It's good to have that stuff in your kit. Next thing I would say is eye wash. Now, this is a smaller bottle. I would not say that this is enough, but it's a little bit better than carrying one of the like Clear Eyes or whatever else is out there, you know. If you need to wash your eye out, I would say, you know, start with water first, you know, clean water first, and then finish up with something like this when you're done. This is another thing that doesn't get talked about very much, and that's your teeth. If you have a toothache, that is like literally one of the worst things that could possibly happen to you out there. I cannot say that enough. There are a lot of natural remedies, ways that you can, things that are astringent in nature that you can help pull out some of those toxins. I use plantain quite often. You can use tea bags, for example. But sometimes people are not really cool with natural remedies. And so it's good to have something that maybe they're more familiar with, so that they can apply it to their gums or to their teeth to help them out with that. Because having a toothache, having an abscess, needing a root canal, whatever, oh my God, toothaches suck. Another thing is having something, some kind of lip balm. I typically use the stuff that has something to combat the sun in it. You can also use this, you know, for small scrapes, etc. All right, the next thing, I joke about it all the time. Y'all have heard me say, don't get monkey butt. If you can't save your own ass, you can't save somebody else's. Having preparation H in your kit. I think that that's a good thing, because when you have hemorrhoids, and for those of you that have never had hemorrhoids, believe me, they're a pain in the ass. I also always have some Gold Bond with me as well. Now you will also notice that I do have some individual bags there. When I was in the field, we would have a whole variety of bags with us, because what happens when you get done taking care of somebody? You have all this bloody stuff laying around in your gloves and all. Do you have a way of disposing of that responsibly and properly? The next part of the kit, which has another see-through bag in it. I have inside of here are electrolytes. I really like snake juice because of the amount of potassium that it has in it. But I'll be honest with you, snake juice tastes like crap. What I will typically do is I will stack them. So here I've got LMNT, and I really like the way these taste, and I also like what's inside of them as far as the amount of sodium, potassium, and the other micronutrients that you need. And it's really important to replace electrolytes, so that is definitely part of the kit. All right, something else that I carry is both daytime and nighttime Theraflu. Now, use whatever works for you. Some people like Alka-Seltzer, or they like Vicks, or whatever it is that you carry. If you get the flu when you're out and about, when there's an emergency, just having something to help with those symptoms It's like a godsend. So I have these because I know that these work for me. Choose whatever it is that you will. That's just what I carry. Next, I just have some regular Benadryl. If it's not a life-threatening thing, then I can give somebody just, you know, some diphenhydramine, maybe even to help them sleep sometimes. Now, I will say a word about that. If you are not certified, licensed, etc., you know, you shouldn't be giving out medicines. The stuff that I have here is pretty much all over-the-counter stuff. I would be very cautious about giving people medicine. Sometimes people are allergic to stuff and they don't realize it. For example, you don't see any iodine on this table. A lot of people have allergies to iodine, and you would feel really bad if you caused a condition you didn't ask them before you applied it. Same thing goes for like latex gloves, for example. You got to be really careful with administering medicines, if you will. Always ask before you give it. And typically what I do is I say, I have this. Are you allergic to it? And would you like some? Yes, next, good old-fashioned Goody's headache powders. For me, this is more of like a personal thing. This is for me. Goody's just works. And so that's why I carry Goody's headache powder. They do have them that have aspirin, and they have them with acetaminophen, and they have them with combos. Go whichever one works for you. That's just what works for me. Also, this is also what I would consider personal medication for me. I use Zyrtec. Some people use Claritin, and you don't have to have, you know, the stuff that's name brand or whatever. You can get just generic cetirizine off of the shelf. You don't have to pay for it, but a lot of times I find that people are more comforted if they have a name brand product instead of, you know, like just the generic single serving friend out of your first aid kit. The power of your mind. The next thing, and I would consider this to be a big one, and I see here that I only have one Imodium packet, which means I usually have two, so I'm gonna put that on the list here so that I can grab some after this. I need another Imodium. I tell you what, if you are stuck up, all right, you're gonna need something like X-Lax, for example, something to get you flowing again. And if you are not stuffed up and you just keep on going, you need something to regulate you once again. Both conditions suck. I would make sure that you have something to take care of both. And then we have an extra bag here at the end. So you'll notice that I actually have 4 bags that are included with this, and I can use any one of them to take care of whatever's left over, or all of them in conjunction with each other. Having plastic bags just makes sense, and I know a lot of people are against them, and I don't know why. I don't think that you should be. I think that they are very handy to have around. So I'm going to go ahead and place the rest of this stuff just out here on the table. That way you can see what I've got. And maybe I can take like a fancy thumbnail or something with it. But I always have plastic bags with me. They're just really handy to have. Now, another thing about this kit, all of the stuff that you see here on the table, it's easily replaceable. I mean, you can just go to Walgreens or, you know, whatever drugstore you have around you, Walmart or whatever, any supply house, and you can replace this stuff. Now, there is some stuff that's in this kit, for example, though, I have to order it. And if you're looking for a prefab kit, well, I would say go to My Medic. I like Blue Force Gear and the kits that they put out. But you know, the professionals, they're really picky about what they get. And so if you're looking for a prefab kit, go to My Medic. They have a lot of good choices. I wouldn't say that I agree with everything in their kits, but they do put out some pretty decent kits. As far as specialty stuff, North American Rescue, that's where I go for all of that stuff. Now, I know a lot of people are gonna look at the contents of this table and they're gonna say things like, JJ, where's the burn creams and ointments? Well, that's one of those things where I'm telling you that protocol changes. Back in the old days, sure, we used that stuff, but nowadays, dry, sterile, non-stick dressings is what we use. Another thing people may be saying that's missing is, where's your cold packs? Well, there's a lot of research today to support the fact that if you use a cold pack in the field, you're just relieving a little bit of the pain, but you're actually lengthening the amount of time for recovery. And another thing that I find is that when I carry those cold packs with me, when it comes time to use them, it's like that little capsule always is broken because, you know, your pack is thrown around and stuff, and it's obsolete anyway. Another thing people are probably going to say is missing is, where's your cravat or your, you know, your triangular bandages? I have a shamag right there. Right now, another thing that I need to write down is I need a few more 4x4s. In my opinion, you just can't have enough of those things laying around, so I'm gonna put some more back into this kit. I do have a bunch in my jump bag, and I actually keep a couple in here as well. But something that I see happen a lot in the field is people take one 4x4 and they stick it on, and then it gets saturated and they take it off. Don't do that. Just keep stacking those 4x4s on until you can stop the bleed. So I'm gonna write down more 4x4s because I know that I need that. Now, like I said, this is not my stereotypical kit. This is just something that I threw together that works in conjunction with my actual jump kit. And I'm hoping that when you see this stuff, that maybe that'll give you a starting point, a direction that you can take so that you can start putting together your own individual first aid kit or a master kit that you can use to help out the people in your family. One thing that I will say that I touched on it in the video, but you know, if you have life-saving medication, you need to have at least a minimum of 3 days of that medication. I would encourage you to try to have at least 2 weeks of it if you can, and past that, I would say up to at least a month. Now, I realize that that's hard to do in a lot of cases. It's hard to like skip days, or maybe you can't skip days. But I would have a talk with your doctor and say, look, you know, hey, I'm kind of prepared-minded here. I'm trying to look ahead into the future. You know, maybe you live in a zone where there's earthquakes or tornadoes or hurricanes or whatever the case may be. And maybe, you know, your doctor can help you out and they can get you the prescriptions that you need so that you have them on hand should, you know, the drugstores or the regular stores be closed and you just can't get your prescriptions. Something that you don't see here on this table is stuff for kids. When I was in the field, we were required to actually carry a small toy or a small game or something like that, just so that we could, you know, help kids out in an emergency. If you have a family and you have small kids, you might think about including something like that into your kit. I tried to keep this as simple as I possibly could because, you know, I wanted people to, I wanted to create a video where people felt like they could have a force multiplier. Like they felt like, yeah, this is something that I can put together. This is something that I can treat a variety of illnesses and traumatic situations, and I won't feel completely helpless. I've also tried to include, you know, some tips or tricks throughout the video. And I've also tried to give you like my honest opinion about some of the stuff that's out there. And I would encourage you, you know, hey, this does not solve all of the world's problems by any means. I know that it doesn't. But what I'm trying to do is I'm trying to help you out and make you a force multiplier in the future. So, you know, if you have something that you want to add to the kit that you think like, okay, this is missing this or whatever. I know something that's going to come up is like, where are your SAM splints? They're right there. All right, you know, where are your NPAs and your OPAs and your suture kit and your BP cuff and, you know, SBO2 counts, and that's all in here. Okay, this is for people that don't have that level of training. So if you're a professional, you know, maybe you could add something into this kit that would help somebody that's not trained. Okay, maybe instead of being part of the problem, you can be part of the solution, and you can help us out, because that's what the goal here with this is to help as many people out as we possibly can. So in the meantime, like, share, subscribe, hit that notification bell, and until next time, keep fueling those fires. Wait a minute, I'm not done. I almost forgot something really important. A watch. You gotta have an analog watch. All right, if you're gonna, you know, take some vitals, you need a watch, bro. I'll catch y'all on the next one. See ya.